Everyone, please turn off your mic. So let's start. Good evening, everyone. Thanks to all of you for being here this evening. As you all know, today's topic is cupping therapy. For that, we are very pleased to welcome our speaker or presenter or mentor, Dr. Avinash Jadhav, a very special guest from Maharashtra. Dr. Avinash Jadhav is MD in Sciatica and also diploma in clinical research. He is specialized in trichology, cosmetic, in psychosomatic disorders, and infertility, and others also having experience to develop formulation in pharma sector. He is also a national seminar speaker for Savitri Bai Phule University, Pune, and today he will be sharing with us his expert opinion on cupping therapy. For that, I want all of you to give your full attention to Dr. Avinash sir and help me in welcoming him. Dr. Avinash sir, sir, now you can start, sir.
Ah, yes, sir. Am I audible, Rajat?
Ji sir,
Hello. Okay, okay.
ji
Should I
sir,
share my
you are
screen?
audible.
Okay, then I'm just sharing.
Ji sir,
My screen is visible.
ji sir. Everyone, please turn off your mic and video all time.
Okay, Rajat, screen is visible now.
Yes, sir.
Okay, then. Good afternoon, all of you. Hope you are getting my voice clearly. So today, Dr. Rajat invited me for the cupping therapy to share my knowledge regarding with that. I'm very thankful to provide with a group and especially Dr. Rajat for inviting me such a things. So in a cupping, I'm not going to. I'm just taking an introductory part and which kind of cupping or what is exactly cupping we can use in our daily routinely day by day practice. The cupping is a very much vast procedure. Actually, we are not aware about that most of the in our syllabus or all those things. These are not included. We are just aware of that hijama cupping or the vacuum cupping only. But the cupping is a too much vast procedure, and we can use that one also. Just in ancient science, also the Egyptian, Chinese, Tibetan, or in the also Ayurveda, there are references about the cupping therapies. In Ayurveda, there is no direct reference about the dry cupping, but that one is alabu or the shrunga. With that one, a bloodletting. That one is also a kind of a cupping therapy, or we can consider that one is under the kind of cupping therapy. As we know, we are all are the Ayurveda students. As we know, the Shrunga, how can we use Shrunga for the bloodletting or the Rakta Mokshan therapy? But nowadays, the Shrunga or the horn are not available, or the it is not having permit with the legal procedure to make a treatment method as a treatment method. So we can use apart from that as a cupping as a Rakta Mokshan for instead of a Shrunga. So we will discuss later on also. And the cupping is a mostly widely used in the Chinese, Tibetan, and naturopathy medicine. The naturopathy medicine is also taking a very huge consideration under the cupping therapy, and the hijama is a holistic approach towards the, some religionous importance is also that one. So already, yes. In the cupping, here we can see that the cupping is an ancient form of alternative medicine in which the local suction is created on the skin. That means the negative pressure is created with the help of some mechanical tool or the some fire cupping tool or some what we can say that the negative pressure making guns also. So it increases the mobilization flows and all those things. But initially we have to understand the energy flow of our body according to the marma and the worm therapy in a caloric marma. If we regard studied with that one, so we can understand that marma is a energy consuming or the energy storing point by which the energy is continuously flowing out throughout the body for the vital works and all those things also. But the if that marma point is a very good in nature and all those things, then the body structure or the body day by day routine work is going to very much easy. The type of cupping therapy is apart very much or a numerous type we can say according to the its a function or according to the cup we are using in that one. There are lots of types, especially the dry cupping, fire cupping, or the wet cupping are three are the considered the most one. The dry cupping, in that one we have to make a suction only. In a fire cupping, suction with a fire. That means if we understand or in the school times we use that scientific or the science project, the candle, the half water in that plate, and apart with that plate a candle is lightened, and above that one we put some glass vessel, and after the oxygen consumption that particular water rises up to that one. So same thing is in the fire cupping. With the help of some artery forceps and likewise the spirit or sterling like solution, we have to insert a fire in that glass, particularly a thick gas vessel is there, and we have to put that glass vessel on a skin, and due to the suction or the lack of oxygen, so cupping is the very much we can say it well. Apart from that, there is a fire cupping. Wet cupping means say the clear cutly the blood letting system. If we want to let or the rakta motion for stanic rakta motion and all those things, we can use that suction method for the blood lenting. But for the blood lenting, we have to use a very skillful and technique hand for the minimal incisions with a surgical blade or the prickling with a 26 number blade and all those things. So that one is also we can consider. And apart from this, the according to the suction or the pressure applied, so there are three types we can consider: the flash cupping, medial cupping, or the drastic or the rectifying cupping. The flash means the weak cupping, medium means likewise the medium pressure we have to give apply. We can adjust that pressure with the vacuum gun, okay, which we will see that on. And the drastic or the rectifying, that one is completely related with the fire cupping section. We cannot adjust the suction force and negative pressure, whatever the spirit and all those things, we have to just win that one. The weak cupping, specially consider that weak cupping is just for the sensitive persons. The cupping can be done from a 1 year child. From 1 year we can done a cupping also, but up to the 12 years old, that child must have a fraction of second cupping. It's like a cup must be with that skin with a weak cupping or the flash force, likewise a 5 seconds to 7 seconds, maximum up to a 30 seconds. We can use in a pediatric also for the cupping system. So keep in mind that one is also we can use in a pediatric also. So next one, there is a different types of cupping. Let me come to my first. Okay, here this one is a horn like earthen pot, bamboo cupping. These are the silicone cups. These are the navi sthapan cups. These are the pressure inserted. That one is the hijama cup. This one is a air balloon cups. This one again is a silicone cup. These are the glass vessels. Okay, so now we consider the silicone cups. The silicone cups are the made of a silicone, and these are specially used for the beautification or the cosmetic purpose or the gliding motion. or the oil cupping, what we say, the oil cupping in the muscular tension or the muscular spasm is there, we can use that one also with the lots of remedies. Likewise, with the regenerating skin type of, we need the anti wrinkle and all those things, that with the silicone, because it applies a medium pressure. And always do this, there are a lot of sizes available in this one. This is mainly used in a cosmetic industry, the silicone cupping. And always consider that if we are using this type of a cupping na, so always use from medial to lateral region. If you want to use at a frontal region, then start from a eyebrow towards the head one. So likewise, we have to use this type of a silicone cupping. These are normally we consider cupping is like a, these only. These are the suction guns, and these cups are very much different in size. Likewise, 0 to 25 or 2 we can get it from market also. Uh, so you can use that one also. Later on, we will see this one. This is very much interesting part. As a Chinese, we all know as the bamboo cupping and the hello, bamboo cupping and the wooden pot cupping. This is the basically used in the China, but basically originated in the Tibetan medicine. What they are doing, they used to boil these bamboo cups or the wooden cups in a decoction of a particular medicine. And then after that they have put same decoction churna, whatever they use for the decoction, they put at the particular site of the where the cup is applied, going to applied on that one, on that site they have burned that churna, and after that the heated bamboo cup or the heated wooden cup is going to insert it, and after that they will like get swollen, or the due to the air compressor the vacuum is created, and that particular same thing we can say in the our cultivasti also we can correlate with that one. Same with the particular temperature, we have repeatedly organized that oil poration in a stanic basti. Same things can be applied, and this one having a greater and too much drastic results if you use properly. If not, you are going to use properly, you have to understand the temperature and all those things, because that can be a very harmful to patient also, because it's taken from a directly boiling water, and we have to inflame or the light that churna on the part of body. So it is a very good drastic result giving therapy as a bamboo or wooden cup, but it's a very much carefully using. If you want to use, you have to carefully use that one, because if that one is a burning happen or something like that, the scar must be there for more than 45 days, or the permanent scar can be happen also. After that, in a Tibet or in a Chinese, the moxa roll or the moxa sticks, moxa stickers are also used. That one is also good kind of a thing. In that one, same thing is happened. The ignited churna or the ignited medicinal stick. Likewise, our dhumavarti, we can say that it is a dhumavarti, and that one is applied or placed over that particular body part, and after that the cup or the particular whatever the cup, hijama cup or the glass cup, whatever the cup is put over that one, and after that with that heating and fumigation procedure, that affected part is a continues to the getting with the medicine. That one is also very good in nature. In the market, that the moxa sticks, moxa stickers are also available, but most of the moxa sticks and all those things are having a Tibetan and a Chinese medicine. If you want to use, you can make a dhumavarti as like an Ayurveda, and you can use it very well. Apart from this, if you very well known about in Maharashtra, there are lots of practitioners using like a Vidya karma with Agni karma. So here we can see that the moxa rolla with a needle on a needle, that image indicates that one is an acupuncture needle. Acupuncture needle is always not in a hollow shape. We in Ayurveda, the Vidya karma must be done with the hollow shape needle. Likewise, a 26 number hollow shape needle or whatever needle you are using. So in according to Susrutacharya, we can use or we can get Agni karma with that needle also. So lots of in Maharashtra, lots of practitioner use a Vidya karma needle for the Agni karma also. So likewise, the moxa roll needling is also a very good part. Apart from this, the moxa stick or the dhumavarti, if we pour or if we just held down that stick or 2 to 3 centimeters or 1 to 2 centimeters from a skin, then also that particular skin part is heated properly, and after that you can use that cup place over there. That one is also very helpful. In the cupping, we have considered lots of things, but the main thing is that the main thing in the cupping, we have to stimulate the underlying organ or the drainage system or the blood vessel system or the circulatory system very rapidly to detoxify the body. So first keep in mind that the first role of a cupping to detoxify or the to increase the blood flow or the circulatory flow towards that organ which is the underlying towards that particular skin area. That one is the goal for the cupping therapy. This one is a close review for the Moxa sticker acupuncture needle, but you can use with that one if you are having that kind of experience and all those things. If you will get that experience, you can use this kind of things with the 26 number needles also. That one is also very great. Apart from that, the cupping is specially mentioned as a holistic approach and all those things in a hijama. That one is a Unani procedure. So hijama, we consider that one is a Unani system of a medicine. We can say that there is a lots of point, but the 7 points in a Unani medicinal system, they said that these are the proper and very good detoxification of a. With this point, we can do a detoxification of a whole body. So the first point is a Yakuf point, which is nothing but the Adipati Marma. That one is directly towards the Adipati Marma. Second point is just to the vertebra and the skull joining notch, upper just lateral towards. Likewise, if we consider that point is around C3 or a C3, C4, nearby that laterally towards, and just medial towards the earpin of lower end of a earpin. The Khalil point is also very much important in that one. That one is at a C7. That one is a vertebra prominence. Some of experts consider that the Khalil point it as a exactly at a C7 vertebra prominence. But some of the experts are saying that that point is below the 2 fingers from the vertebra prominence. That one is a debitary part, but I'm using that Khalil as a vertebra prominence. And all this, apart from that, the Varak point is very much important, as that one is just a medial, 2 finger medial to the superior iliac spine. So that one is also one of the most important point regarding with the gastrointestinal discomfort and diseases, which is explained in Ayurveda also for the Vedan and the Rakta Mokshan also. But with that point, we we cannot use the incision method or the pricking method, because all the what we can say that the female genital organ borderline, like the ovary and all those things, are just lining below that point. So we have to use over there Chalauka one. again, that one, the foot point is also very much important for the neuromuscular disorder regarding with the lower extremities. That one is just above, two finger above the Indra, sorry, Kshipra Marma. Yes, Khalil point is a much more importance having in a Unani medicine. Khalil point is having much more importance in a Unani medicine as that of in a Yakub point. That one is a Adipati Marma. That one is having same kind of a important in a Siddha Varma. As I said already, the cupping is a strictly in recommended or the practicing in a naturopathy also. So naturopathy is a reflectory system of a allopathy system. So in a naturopathy, there is a no that much kind of explanation about a weight cupping. No that much kind of explanation about a weight cupping. They all are naturopathics, or a naturopathy system is basis on the dry cupping therapy and the surface anatomy, as they are following the modern system of anatomy and physiology. If we understand, and all naturopathic cupping therapy points are laid down the back only, nothing on more than that, each and every. If we understand, or if we see through this image, you can see that the all points are just the surface anatomy of each and every underlying organ, if we consider the with the anatomy, sorry, with the Ayurveda, so we can use the kidney point, same. If we reflect anteriorly, that point for the Vedan and Raktamokshan for the gastrointestinal vyadis and all those things. So like that one, we can use that one. If we see the Khalil point is also, these number are the just taken from the internet. So these number are the Chinese medicinal number. That one is not important, as we see. Lungs, and here we have to apply the same or the same things regarding with the cupping. Here we apply the forces we have, and we should release the lymphatic drainage and improves the blood circulation for the particular thing, and that organ will be affected or get relieved very fastly. The second thing with the cupping therapy, we should understand the Nabhi Puran. Actually, I am not using that Nabhi Puran or the Nabhi Sthapana. Nabhi Sthapana one. But in the Nabhi Sthapan or the solar plexus correction, we should use this kind of a Nabhi Yantra. For that one, we should, in a male patient, from the nipple, we have to measure the length of a Nabhi from the two nipples. Right, some disturbance is there.
Hello. Hello.
Sir. Is there any disturbance?
Okay, sir. एक second, sir. Sir, hello.
Yes.
Hello.
Hello.
हाँ सर, अब ओके सर? अब ओके सर?
Yeah.
ठीक है सर.
Okay. In a Nabhi Sthapan, we should, in a male patient, we can measure that Nabhi from the nipples, and with the consideration, we should understand. But frankly speaking, I am not using this one as for practical therapy, so I cannot explain this much kind. Okay, this one we will see the later one. Now the point is indications and the contraindications. Indications and the contraindications for the cupping therapy. For the cupping therapy, the patient should understand all those things. We have to explain the things. That means the scars are must be there for likewise 4 to 5 days or maybe more than 45 days. And the first thing you have to understand while doing such a things or while doing any kind of procedure like this, you have to take a consent in a written, not in a printed form. That printed form consent is not applicable as a in a legal procedures also. In a indications, the urdhva vyadhi, likewise the hair fall and all those things, baldness area, dandruff area, all those things, we have to do weight cuff weight cupping, and that weight cupping is directly applied to the area of a baldness or the dandruff area. So as we know, the in a ayurvedic, we have to do a raktamokshan, sthanik raktamokshan for the indralupta or khalitya or palitya or darunaka. So for that one, we can directly apply that one body area. And apart from that, if there is any kind of upper respiratory or sorry urdhva jatrukat vyadhi, likewise a headache or the recurrent penis and all those things, we can do raktamokshan at the adipati marma, which is a very good giving result marma and having more importance in a siddha varma pathy. That one is a very much importance in that one. Second thing, that one is if we are doing a skin disorder like a therapy and all those things, we can apply what uh, cups to directly to the affected part, likewise the eczematous patch or the psoriasis patch, the tinea infection. Likewise, we can apply directly to these things. But while using a sliding or the gliding or oiling therapy or the for the fire cupping, we cannot use directly to the particular open wound and all those things. In an ear disorder, or like something like when the pain in the ear or the hearing problem or the tinnitus like a structure and all those things, that ear disorder can be corrected with the if I'm having a ear problem or the hearing problem or something like that with my left ear, then I'm just have to put dry cup or a temporomandibular joint towards the left side, that dry cupping, and apply a very much medial pressure for 7 to 10 minutes. Just keep in mind, every time if you apply the dry cupping, 7 to 10 minutes is the recommended time for that one. And for weight cupping, the desired blood amount should be letting, and after that we should change that one. Then for the ear disorder, after that we can say that if there is a problem in something like that, the tonsillitis, recurrent tonsillitis, or problem in swallowing and all those things, so we can get it down with the dry cupping or a weight cupping for both temporo mandibular joints at the same time. It's not like that the I'm just doing with the left right now and tomorrow right one, not like that one. The temporomandibular joint is also. Apart from that, the temporomandibular joint is also important with the marma chikitsa for the sensory development or the stimulation or the conservation of our sensory organ. That temporary mandibular joint is having too much important in a marma. That one kalari varma therapies. Then the neurological disorder. Uh, First, we have to say that the respiratory disease, the dry cupping. Actually, the dry cupping is not having that much kind of a what we remedies for the respiratory disease or the upper respiratory disorders or the vyadis. It just already I have seen, we have seen that uh, this kind of a cupping points, we can use that one as a dry cupping, but this one improves the only circulatory things. Blood circulation is enhanced and the lymphatic drainage is enhanced, but the things are very much, that one is a not result giving point. So satisfactory, not like that one, just to improve the blood circulation and the stamina for that one. But if there is a recurrent URTI, or we have to stimulate our sensory organ, so we have to must do a weight cupping at a Shankamaram point. After that, for the same reason, we have to use after recurrent venous or the recurrent sinusitis also. There are the lateral to the nose tip, just below the eye side, we can do a weight cupping for that one. Also, that temporomandibular joint giving very much good result in a neuralgic disorder. Also, that one is very much important. And in inflammation, for the only pain is there, then the dry cupping is sufficient. But if there is any swelling or something like that, when the inflammatory disorder and all those things, so we have to go for the weight cupping at that points. As I said that already, for the tonsillitis and all, we have to do same for the. Then the neurological or the postpartum hemorrhage and all those things, sorry, postpartum hemorrhage, hemiplegia and all those things, we can consider it that one is a neurological disease. The neurological, whatever, just keep in mind, if you want to get a go-to result with your patients, the whatever neurological disorder, you can correct with these 3 points, as I have already used it. That one is Adipati, that one is a C7, and Varak point, or just the cucumber murmurs, which is the sacroiliac joint notches, just below that one. 1, 2, and 3, and 4. You can get very much good results with that points also. In a musculoskeletal disorder, you can get that results. If we consider these 4 points or 3 points, 1, 2, and 3, 4, that means 1 point. 1, 2, and 3 points, you can get very much result and good result, and you can use these kind of points for any kind of disease. It is also important, as in my practice I have seen, with the any kind of disease with the trunk and all those things, we can use this point and getting a good results. Then the neck and shoulder. Neck and shoulder, that one is a very much good one, but I'm not. Neck and shoulder, if we consider this is a neck and shoulder, that already I have explained that 2 points, that C3 level, this medial aspect point, but I'm not using these points for cupping. But neck and shoulder, you can use a wet cup or a dry cup at a painful area, but you can use that gliding point, gliding method. For that one, you have to apply the medicinal oil, and you just with the silicone cups, you can use such a gliding from a medial to lateral side, likewise the shoulder, then arm, forearm, and palmar. That one gives a very good result for this neck and shoulder points. Apart from this, if we consider the neck and shoulder, likewise the cervical spondylosis at the Bruhati Marma, from this point to this point, likewise the Bruhati Marma and the upper border of the scapula, if we consider with the cupping therapy, that one is also giving a very good result for the gliding and all those things. Again, then the cupping therapy, most of the this slide, the order is changing. Most of the athletes are doing nowadays. As we know, the most of the swimmers, athletes, runners, and all those things, they are using cupping therapy, as they don't want to get or consume medicine or like a dopa test and all those things. They don't want to face that things. So what they do a particular cupping method for the strengthening of muscles. As we see, all these athletes having some kind of a scars over here, they don't know need any attention towards the beautification and all those things. They need only the muscular strength. If we consider if we swimmer body and all those things, the wet and dry cupping we can use that for the muscle strengthening alternately. So we can use in that one, as per my view, in atrophies or the in after the pakshavada and all those things where the muscles are getting less comfort and less tone. So cupping is the one of the most important factor to tonification the muscles also. So as we see these kind of things, apart from that, strength of muscles is increased with this. For the runners, these are the athletes or the bodybuilders, they are using these kind of things. We have to identify that muscles which we should have to uh, strengthen that one, and after that we have to consider. Then the spinal disorders. The spinal disorder again. So all those, if you understand, I will share some one of the book to Rajat. He will circulate all over the groups. As you can go through that book also, PDF book. You just see that only the three C7, Adipati, and the sacroiliac joint points having a too much importance in a cupping therapy. Cupping is not a bloodletting therapy or vacuum therapy. They are having such kind of a very much importance in that one. If you are having a spinal disorder regarding with any kind of thing, any kind of a spinal disorder, you can use these 4 points as a whole spine refreshing, as a Adipati, C7, and the two Upundas or the two sacroiliac joint points. You can use that one as a bloodletting points, and you can get a very good result in a patients. Then already I have shown that the for these kind of things, 7 to 10 minutes is the ideal time for a dry cupping, and for a blood lenting you decide according to the patient. Then thyroid disorder, this is also one kind of a therapy I have seen in some patients. It's not considerable, but actually, but as I have read some things or papers, so I am sharing some things. In the thyroid disorder, you can apply dry cupping directly over the gland with the appropriate size, with a flash-like pressure or the minimal pressure. That one is also giving a result as they said, but I don't know exactly about that. And in HTN or a hypertension, you can use, sorry, for thyroid again you can do a weight cupping from a C7 vertebra, directly from a C7 vertebra, weight cupping. And in a HTN, you can say that from the Indravasti and all those things, from Indravasti, you can do a dry cupping, as it clearly mentioned in the naturopathy books, that for a hypertension, you can just put over a dry cupping over the Indravasti marma. That one is also giving important. If you are not getting properly, this is what I am saying, that fire cupping side effects which we will get if you are not having a skillful hand and all those things. And screen refraction reaction after cupping. So there are several type of skin reactions we can say, or we can say in that one. So it is just an introductory part, as Rajat said. It's not a huge one. If we consider only the musculoskeletal disorder or the spinal related disorders, so you can get it with the results with the only 3 to 4 points. If we go through it, you can get any kind of a result or any kind of things. As per this, this Varak point already we have mentioned in a already we have discussed about, but this point is also can we do weight cupping on normal points? Yes, we can. As we are not pouring in that one, we are just superficially making a cut, so we can do that one also. And this one is just getting result in infertility also, so that one is also corrected. If we consider the Nabi is the pressure cooker of our body, so everything is a sucking by Nabi, so we have to understand that also. But Nabi Pura Nabi, so I can't say about that. And again, as I said, in a Siddha Varma Chikitsa, the C7 vertebra and that sacroiliac joint having that much importance in a what we say spinal or the vertebral whatever the disorder also, or seeing or gone through the chiropractic or physiotherapy also, they are having that much importance with the C7 and sacroiliac joint notches. With that notches, they identified the subluxation of intervertebrae muscles and all those things. So they will understand, and like this one, we can consider the cupping also. Okay, thank you, Rajat.
Thanks to you, sir, for this wonderful session. Uh, if any have if any have any questions, then please send it to chat box. Hello, am I audible? Hello, uh, Avinash sir.
Yes, you are audible.
Hello, हाँ सर डॉक्टर सत्येंद्र सर का क्वेश्चन है व्हाट विल बी द ड्यूरेशन
Huh.
फॉर वेट ड्राई कपिंग
Dry cupping, I have already mentioned that if you are considering the 1 year to 12 year, that one is a like a fraction of second must for the dry cupping only, and up to
ओके
the like a
जी
30 seconds. And for in a normal adult, must use like a 7 to 10 minutes for dry cupping. Or for the wet cupping, it is depend on a patient and patient's condition. How?
जी सर
After that, you will decide that one.
सर
Okay.
ओके सर तो डॉक्टर अभिषेक का क्वेश्चन है सर हाउ टू गिव इंसिजन इन वेट कपिंग
Wet cupping, how to give? That one is a skillful surgeon's hand medicine. Likewise, we should not cross our like second layer of skin. We have to like a what we called very skillful actually.
सर वो ये पूछना चाह रहे हैं कि वो जो हम इंसिजन देंगे वो कितना डीप
Hmm.
होना चाहिए और किस टाइप के इंसिजन देने हमें
किस टाइप सुपरफिशियल इंसिजन देने डीप नहीं 1 to 2 mm maximum. And if you are not having
जी
that much kind of a things na, so you can go with the 26 numbers needle and multiple pricking with in a continuous manner, then also you will get that result. But if you want to get a good result, you have to use that particular blades also. Then otherwise just go for the jaloka, my opinion is that one.
जी सर सर आई थिंक क्वेश्चंस कंप्लीट हो चुके हैं सभी के
Okay.
अ, जी सर सर एक बार जो आप उसमें बताए थे सर डैंड्रफ में जो कपिंग के लिए
हाँ,
कह रहे थे सर एक बार रिपीट करेंगे
कपिंग डैंड्रफ और द वेरी ऊर्ध्व जत्रु का जो भी है अपना, तो उसके लिए अलग अलग पॉइंट्स दिए हुए हैं। दैट वन मैं बुक तुम्हें शेयर करता हूँ रजत लास्ट ऑन। ओके, लेटर ऑन।
जी
वो
हाँ
बुक
सर बिल्कुल
पीडीएफ का शेयर कर देना सर्कुलेटरी, क्योंकि इसमें क्या है, द सेम पॉइंट्स आर कमिंग। Likewise, what I am saying, these 3 points having that much importance. You can practicing with the 4 points also. You can practice with the 5 points also. And directly with the in a especially in a hair trichology, I am using that one in a trichology for a baldness and all those things. For a local रक्त मोक्षण, स्थानिक रक्त मोक्षण बताया हुआ है प्रक्षण टाइप पे, नित्य
जी
प्रक्षण बताया हुआ है, all those things.
जी
So you can use with the shaved scalp directly, scalpel से या blade से उसको incision लेना है और उसको कप लगा देना है. सो स्थानिक रक्त दूषित निकल जाएगी। उसके बाद में जो भी एक्यूमुलेटेड पित्त है रूट्स पे, केश भूमि एक्यूमुलेशन जो है पित्त की वजह से, तो वो निकल जाएगी। उसके बाद में आपकी जो भी थेरेपी है उसे वो क्लियर हो जाएगी। इट्स अ ट्राइकोलॉजिकल कंसेप्ट। देन
जी सर सर सियाटिका कपिंग इन सियाटिका
हाँ, सो मैंने वही बोला ना कि अगर ये कपिंग इन साइटिका लाइकवाइज जैसे रनर हम देखते हैं, तो जैसे मैंने अभी बताया द कायरोप्रैक्टिक एंड द थिंग्स सिद्ध वर्मन लाइकवाइज कलरी वर्मम, बेसिकली वर्मम, नॉट मर्म, वर्मम. In that one, they are having that much importance in Nitamba marma and Kokondar marma. So with that we can use, and apart from with the sciatica, we should make sure that our cups are at थाइस के मिड लाइन पे नीज तक जाना चाहिए ड्राई कपिंग।
जी
तो
सर।
उसमें भी रिजल्ट मिल जाता है। अपार्ट फ्रॉम दैट द कॉम्प्रेशन शुड, हाँ एक चीज रह गई थी बताने के टाइम पे, द लैटरल जैसे स्पाइन डिसऑर्डर पे आ जाते हैं हम लोग, तो कॉम्प्रेशन एंड बल्जिनेस यू हैव टू आइडेंटिफाई दैट कॉम्प्रेशन एंड बल्जिनेस एंड ऑल दो थिंग्स। अपोजिट साइड के लिए हम उसको है ना प्रेशर कप लगा सकते हैं। सो दैट मैंने देखे हुए पेशेंट्स मेरे सर के पास भी और कुछ मैंने भी किए हुए हैं। सो दैट डिस्प्लेस्ड इंटरवर्टेब्रल डिस्क कैन बी ये आ जाती है उस जगह पे एनाटोमिकली। सो फॉर दैट वन यू कैन यूज फ्रॉम अ सर्वाइकल टू कॉक्सिक्सिलर रीजन, जो भी कप्स है अपने दोनों तरफ साइमल्टेनियस बायोलैटरली सेम साइज की लगानी चाहिए ड्राई कपिंग। सो इट्स अ पार्ट ऑफ likewise experience taking.
जी
This cannot be using. I'm just
यस सर।
taking a introductory part. As I have already mentioned, again I am mentioning that there are lots of points, but some practitioner I have seen they are using only 3 points, and they are getting result for each and every practice. Next one.
जी सर। तो एक क्वेश्चन है सर, कपिंग और अग्निकर्मा में पेन के लिए कौन सा बेस्ट रहेगा, और
Hmm.
कैसे डिसाइड करना होता है कि अब वो कपिंग करना है अब अग्निकर्मा करना है?
If there is a pain, only pain, okay. If there is a pain,
जी
as
सर।
I already said that the cupping, dry cupping is mostly applicable or mostly getting towards by the naturopathy, and which is fascinated from a modern allopathy and physiology. If there is only pain, you can go with the dry cupping. And if there is agni karma and all those things, that one again is very much having that kind of entity, and results are also there for that one.
जी सर। ओके सर, थैंक्स अ लॉट सर फॉर दिस वंडरफुल सेशन। थैंक्स टू एवरीवन फॉर दिस
Someone,
फॉर बीइंग हियर दिस इवनिंग। हेलो।
just 1 minute. Just someone is said like that eczema, just flashing that message. I think just hold on.
व्हाट अबाउट एक्जिमा सर? प्लीज शेयर योर एक्सपीरियंस।
Yeah, eczema.
हेलो।
What kind of eczema do you want? Dry eczema or the wet eczema? If there is a wet eczema, you have to consider that dosha utpatti and all those things. And one more thing, if that kapha dushti, then go for the fire cupping with the glass vessel. If there is a Vataja Dushti, then go for the Hijama cups, as we letting less blood. For the Kapha Dushti, their force is too much heavy for the fire cupping. And eczema, for the wet eczema, you can apply around the eczema that cups, and for dry eczema you can apply with the directly on that point, but that one is very much in that one having good results,
जी सर।
actually eczema.
सर टिनिटस के केस में सर कपिंग थेरेपी।
Tinnitus, you can directly apply that tinnitus if there is not using, just consider if that one is a rakta dushti or likewise a pitta dushti, you can apply directly on that one. If you are not confirmatory about that particular thing, then you just apply just side of that particular. Apart from that, just side से मुझे याद आ गया, जैसे जॉइंट डिसऑर्डर में भी हम इसका यूज कर सकते हैं कपिंग थेरेपी में। तो ड्राई कब लगाना है, तो जो भी अभी जैसे मेरा नी ज्वाइंट ले लिया, तो उसके बाद में जो है, तो हमें उसके जो भी मस्कुलर पार्ट है उस पे उसको ड्राई कब देना है। और टू अवॉइडिंग द मेजर ब्लड वेसल्स यू कैन यूज what can called weight cupping also. That one is tendon injury, muscular injury. Likewise, we are getting that one result. Apart from that, if you are having that particular medicated oil application and after that gliding dry cupping, then also with the silicone cups, but obvious, that one is also giving a very good result. Apart from that, with the help of silicone cups in the beautification industries, there is a likewise a in a figure management you can use that one. So that one is also with the help of our Ayurvedic medications, rejuvenating therapy, oils and krutas also. Hello, Rajat. Hello.
Uh, Thanks a lot, sir, for this
Hello.
wonderful session. Thanks to everyone for being here.